Hello, everyone, and welcome. Let me see here. There we go. That's better. My slide wasn't cooperating. Hi, everybody. My name is Amy Jolly, and I have been a nurse for over 20 years. If you work at my child care center or if you work in another child care center, I want to welcome you to this training. You are in the right place. Today, we are going to talk about medication administration in the child care center specifically, or setting specifically. I am not going to make you look at my face the entire time of this training, but I did want to at least to introduce myself and say hello and welcome. I am glad that you are here. With that being said, let me turn off my camera so we can focus on the slides and the content, and we will get started. So, medication administration is one of those areas that it's super easy to take for granted or assume that it's really easy. That's why we're going to spend some time talking about it today. Not only will this training help fulfill some training hours for you, but my goal is to increase your understanding of some of the what and the why to help you gain confidence in your abilities and care for these precious kiddos as well as we possibly can. Let's see. Next slide, please. Okay, so this is the resource that I used. I am using the minimum standards for child care centers. This is the subchapter, and it is from Texas. So if you are in another state, your specific practices or policies might be different. But I do want you to know that this is where it came from. And again, you can always reach out to an administrator on your team, your facility policies, or your licensing professional can always help you understand exactly what you might do a little bit differently. But this is just to help guide you through. Okay, so medication, something we already know about, but why do we need to define what it is? Well, for purposes of the child care center, medication is a prescription or a non-prescription medication that does exclude, which means does not include, topical ointments such as insect repellent, sunscreen, or diaper ointment. However, at the child care center I work at, we do also have a form that we have parents sign and bring when they bring in, the diaper ointment or insect repellent, but your facility might not have you do that. So that's a question I would ask. The other question you might want to ask is whether your facility also allows natural or herbal preparations. So something of that nature might be a roll-on for, essential oils to help calming or something of the nature. So again, find out about your specific childcare facility, but at least now you are aware of that and you know what questions to ask, right? Okay, so authorization from the parent. In order to give any medication to a child in a child care center, you need to have the parent's authorization in writing. It needs to be signed and dated. The parent also needs to bring in the specific medication. So if Susie's mom is bringing in or wants her child to have Tylenol, and Billy's mom wants him to have Tylenol, Susie's mom needs to bring Tylenol for Susie, and Billy's mom needs to bring Tylenol for Billy, okay? So the parent has to authorize it, and the parent also has to bring it. You can also get authorization in electronic format, such as an email, but it needs to be something that can be viewed and saved. And in our facility, we'll accept it as long as we can save it and print it and put it in their file. The other way you can get authorization on a limited basis is by telephone. So if a parent would call, they can give you authorization for a single dose only. And again, it's for a medicine that they have already brought in the past. So these are the ways that you can get authorization. This authorization is good for 1 year, but your facility might have a different policy than that. By the minimum standards, it's good for a year. My child care facility, where I train our staff, we actually have the parents fill out a new form anytime a child moves rooms or ages up into the next classroom. So we definitely have them do it more often than a year, but that form is good for up to a year. Again, your child care center might have specific policies on that. Now, the dose may not exceed the dosing on the label instructions or the medical provider. So if, let's use Tylenol, for example. If the Tylenol bottle says that someone of this certain age and or weight can only receive 1 teaspoon, Susie's mom cannot write on the form that you are to give 2 teaspoons. What you are giving needs to fall within the guidelines of what the package says. If it's a prescription, the medical provider can write a dose higher than, on the Tylenol bottle, for example, but a parent cannot override the directions on the packaging. Authorization is not required in an emergency. As long as you are giving a medication with good intent and in good faith, and you are using the medication as intended. And the easiest example I can think of this for you is if there was a child who was having an allergic reaction to something, and you felt that you needed to give them some Benadryl to save their life and slow down that allergic reaction. The authorization from the parent in that emergency scenario only is allowed. Again, if you have any questions about that, don't hesitate to reach out to your administration team, look at your child care center policies, and you can also ask your licensing representative. I have found them actually to be incredibly helpful. So, how do you administer medication to a child? This sounds, again, super simple. Unfortunately, it also can be pretty dangerous. If any of these things are done wrong or incorrectly, then that could potentially pose, danger to that child. So an easy way, an easy acronym that I have always used when administering medication, you'll see it on the bottom of this slide here, Dr. Time. So that'll kind of help you remember all of the things you need to check each and every single time you give a medication. So the D stands for 2 things. You need to make sure you have the right dose and the right documentation. So let's use Susie Q as an example. I need to make sure that I have the form signed by Susie Q's mom stating that I can give this medication. I need to check the dose on the document that mom brought in for Susie Q. And I also need to check the dose on the bottle of Tylenol and make sure it all correlates to Susie Q. If Susie Q is 2, I need to make sure I'm not giving a dose appropriate for a 12-year-old. So all that follows under the D category. The next letter in our acronym is R for route. Now, what this means is how you administer the medication. Most of the medication given in a child care center is given orally or by mouth. There are other ways to give medication. Typically, you guys are giving medications only orally. There might be something topically like on their skin, but you certainly aren't going to want to give diaper ointment by mouth. So you always want to double check your route and make sure that that is correct. Now the T stands for time. So this could mean 8 o'clock every morning or 2 o'clock in the afternoon, but it also can mean when a medication can be given, again, let's use Tylenol, for example, every 4 to 6 hours. I need to double check when the last dose was given to make sure that I'm not giving the doses too close together. The next letter in our acronym is individual. Now, sometimes med errors are unfortunately happen because the medication was right, but it was the wrong child. It's hard sometimes to identify or verify the identity of a child. Now, if you have obviously worked in the child care center for a while, or these children in your care, this might not be so difficult, but even students that I give medication to every single day, I will at least look at them and say their name. So if I'm giving medicine to Susie Q, hey Susie, how was your day? Now, you can't do that with an infant, but in a childcare setting, that is an easy way to just have confirmation of you talking to the right individual. Have you ever been talking to someone named Steve and accidentally said the name Sean because you had just talked to Sean 5 minutes ago? Sometimes that can happen when you're giving medication. You're distracted, you're thinking about something else. So this is just, a good habit to get into to verify the individual by saying their name. The next letter in our acronym is medication. So if we have an order, again, let's use Tylenol as an example. Some people in their mind will confuse Tylenol and ibuprofen. Now, Tylenol and acetaminophen, which is the generic name for Tylenol, which is a brand name, are the same medication. Ibuprofen is the same as Motrin, is the same as Advil. However, Tylenol and Motrin are not the same thing. But because they're used for very similar purposes, sometimes in people's minds, because they are both over the counter and they are so common, they might be thinking of one and saying the other. The reason this might be an issue is if Susie Q's mom writes out a paper for you to be able to give Tylenol, but she inadvertently brings you ibuprofen. So then officially you don't have permission to give the Tylenol if your document says ibuprofen. So always check your medication. And the last letter in our acronym stands for two things, the E. Always check the expiration date whenever you give a medication. If I give a medication every single day, I still look at that bottle every single day and check the expiration date. Now, on some of these bottles, especially the plastic bottles of, let's say, Tylenol or ibuprofen, there's a little pre-printed date on there. It's super easy to rub off, especially if the bottle leaks at all and it gets sticky and you wipe it down. So what I always do when I have a bottle of medication, and you don't have to do this, this is just a hack that I like and it's easy for me to remember and easy to check, is I'll take a red Sharpie as soon as I get a medication bottle from a parent, and I will write in red Sharpie on the top of that bottle when it expires. So that way it's just an easy way for me to check. It's super fast. I don't have to look for that little printed, stamp of when the medication expires or it may have wiped off. That way that's not an issue. But it's a good habit to always check that, and that's just an easy way to make it easier for yourself. The other E is effect. So an example of this is if I'm giving Tylenol, I'm probably giving it for pain, right? I'm not going to give Tylenol for an allergic reaction. They're two different things. So just make sure that you understand what the medication is being given for. And if you ever have questions about that, you can always ask the parent, hey, why are we giving this? Or what is this for? And if you're not sure, you can also ask your administration team. If there's ever a medication you're not comfortable with giving, you can say you're not comfortable with giving it, but I would direct you to your administrator for that. And that way they can, either talk you through it, you could learn about it, they can provide an alternate person to give it or whatever. But as a little side note. But you always should know why you're giving the medication and what its intended effect is, so that way you can see if it works or not. If your child care center doesn't administer medication at all, that's okay. According to licensing and the minimum standards, a child care center doesn't have to give medications. My child care center does, but if yours doesn't, you just need to notify the family before enrollment in writing, or when a family presents their request to you for medication, you need to present to them in writing that you do not administer medication. And again, if you personally have questions or concerns about giving a medication, I am going to direct you to always talk to your child care, your facility director, so that you can ask those questions. You should be confident, and I want you to feel empowered when you give medication and truly know, what you're giving and why. And you will always be safe if you get yourself in this habit of using this acronym, Dr. Time, so you remember to check all of these things off. And That way you truly, truly, truly minimize potential errors and potential, side effects or bad effects from medication error. So medication storage. Medication can be dangerous, especially to small children. So we really need to be mindful that medication is always out of the children's reach or locked in storage. So in my childcare facility, we keep the children's medicine in a separate room. We have a workroom, and the permission form that there's a form that stays in the bottle with the medicine in the bag for Susie Q, and all of the medications for each of the children is kept separately, but it is kept out of the children's reach always, or locked away in storage. Medication always also needs to be kept away from food. Food and medication don't mix. Don't eat where you're giving medicine. Don't eat around where you prepare medicine. Food and medication always need to be kept separately. This is especially true if you have a medication, let's say, for example, an antibiotic that needs to be refrigerated. It cannot be kept in the same refrigeration as food. So our childcare facility does have separate refrigeration for medications, and then a separate one for food and staff lunches and whatnot. But medication and food do not ever get stored together. And let's see. And if the medication is no longer needed, or if the medication is expired, or if the child has left your childcare facility, you don't keep those medications. You can return it to the parent or dispose of it properly. You can also make sure, even if it's expired, I always give my parents the opportunity to take it if they would like it before I just dispose of it. Okay, so this is something called specialized medical assistance. This isn't something we see a whole lot at my child care center, but you might. What this entails is anything that the child may need other than medication. And you'll have a doctor's order for this. Let's say someone is born and they have a brace on one of their legs to assist them in walking. Or sometimes might have an infant with a helmet on their head to help with shaping of the head or protecting their head. That's what this is talking about. So the specialized medical assistance. Again, you will have permission from the physician. It can be, the protective helmet, the leg brace, the apnea monitor. But if you do have a request from the parent, there are guidelines in the minimum standards. We do need to provide that if we do have a doctor's order for it. There isn't a whole lot to say about it because it really truly doesn't take up a whole lot of any child care center's time. But I just wanted to mention it because it is mentioned in this section of the minimum standards. Along the same lines, we are going to spend a little bit of time now talking about a food allergy emergency plan. So what is this? We're going to switch gears a little bit. This is actually becoming more common. More and more people are developing food allergies. Over a 10 or 11 year span, food allergy incidence actually increased over 337%. I believe every 3 minutes is how the statistic goes. Every 3 minutes in the United States, someone has to go to the emergency room for an allergic reaction to food. So food allergies is something we definitely want to be always aware of, even if we currently don't have anyone in our classroom or in our childcare center who has a food allergy. You just never know. So we're going to spend a little time here talking about this. I want you to be aware, these are the top 9 food allergens. Currently, as of this recording, it's still considered the top 8 that have to be listed on a food label. And the top 8 are the first 8 on my list: the milk, egg, peanut, soy, wheat, tree nut, shellfish, fish. Those are the top 8 food allergens. They are trying to pass sesame and make it a top 9 food allergens list. And the reason for that is because if sesame is in a product, it doesn't necessarily have to be specifically highlighted on a food label. Well, more and more people are becoming allergic to sesame. So it would be really, truly helpful for those individuals and those families to have that highlighted. So I know that is something that has been proposed currently and is being trying to be pushed through. But as of this recording, there truly is officially only a top 8, but top 9 I foresee in the near future that sesame will be added to that list. But any food, truly any food, can cause an allergic reaction. It's not just these. These are just the ones that we see most often. A person can also develop an allergy even if they have eaten a food before without any reaction. I have experienced adults who have developed food allergies in their 40s. And it's something they have eaten their entire time. I had a student at school develop a food allergy and started to have an anaphylactic reaction, which is a really severe reaction to a food that he had eaten his entire life. And he was in middle school at the time. So just because you don't have anyone with food allergies in your facility currently, I want you to truly be aware of this and feel comfortable with this information, just because you never know when this could happen. If you do have a known allergy, or a child in your center with a known allergy, you have to have an emergency care plan on file for known allergies. And that's a form the doctor will sign. Something else that I want to mention quickly before we move off of this slide is it's not a food allergen, but sometimes it can cause a cross-contamination allergy. If you use gloves to give the kids their food, if you're using latex gloves, latex is something that can cause a severe allergic reaction. And it is one of the more common allergens overall. Like I said, specifically, it's not a food, but it might be related to food distribution if you do use latex gloves in your facility. So I wanted you to be aware of that. Okay, so this is what a food allergy emergency care plan could look like. This one is from the Food Allergy Research and Education Society. They have a website. This form is free. A lot of facilities or a lot of physicians in my area use this form. It's a pretty standard form, but it doesn't have to be this form. If a physician has their own form that they print out or fill out or sign, or if your child care center has their own specific form, that is fine. This is just an example. They all pretty much have the same data. It just might be laid out a little bit differently. So I'm actually going to grab, let's see, my pointer here, and we're going to highlight a couple of areas. Ideally, your form, see how this one here has a place for a student's picture? That's just another form of identification. Ideally, you have a current picture of the student on this form. And that's for a couple of reasons. If you truly are having a student with an allergic reaction, your adrenaline spikes. If you've ever experienced an adrenaline spike, you know, sometimes it's kind of hard to think or think clearly. This is another one of those identifiers that's an easy way to check the identity of the child, is by having a current picture here. Now, everything else over here will have their name, what they're allergic to, you know, their date of birth. A lot of forms now are also saying, I don't know if you can read it on my slide, but here it says asthma, whether or not the child has asthma, and the doctor will check yes or no. The reason you want this data is because if they have asthma, they probably also have an inhaler. So we're going to talk about the allergy medicine here in just a little bit, but if they're having an allergic reaction, it means their body is overreacting and they're having some inflammation. If they're having inflammation in their lungs, in addition to the allergy medication, this here helps you identify that you might also have an inhaler, which is going to help them try to keep their airways open so that the reaction, doesn't cause more issues. So we're going to go right here to this box here. So these are considered severe symptoms, okay? And each doctor and each child, depending on the severity of their reactions in the past, what the family history might be, there is a box that they can check. If the doctor checks this box here, give epinephrine immediately. If the allergen or the food that they were allergic to, let's use peanuts, because there are a lot of kiddos and people who are allergic to peanuts. So if the peanut was definitely eaten, even if there are no symptoms, it doesn't matter. If this box is checked, you are going to go ahead and give that epinephrine. And again, we'll go over the medication a little bit later, but I want you to see that some children have this form checked. I have also had students have the form, a box on their form that says even if it's just suspected that they ate it or came in contact with it, you give it. So always check your particular student's form and see what that directive is from the doctor. So the severe symptoms, when I am training my staff, I like to highlight, essentially, if you think about anything from your nose to your lungs area, okay? Those are considered severe symptoms. So they might have trouble breathing, be breathing kind of fast. They might say their heart feels like it's racing. They might look pale because of, the blood flow is different. Their throat might feel tight. You might hear them clearing their throat because it feels funny, like something is back there. Their mouth, they might say their mouth or tongue feels funny. You might physically see swelling. You might notice that their lips look different. You could also notice something on their skin like hives or a rash. Their stomach. I have seen kiddos having an anaphylactic reaction. If it's something they ingest, your body is trying to get rid of it. So any kind of vomiting or nausea or stomach pain could be an allergic reaction. And then there's a couple other symptoms, that feeling like something is wrong. I've also heard it called like a sense of impending doom, like you might not even see any symptoms yet. But if it's a child, especially if it's a child who is able to speak, or if they can't, if they aren't even saying anything, they just have this look on their eyes. They just look like they are super scared and their eyes are as big as saucers. These are some of the things that are letting you know that it could potentially be a severe reaction, okay? So we are going to go down here. You inject epinephrine immediately, and then you call 911. In this order, epi first and epi fast. Then you call 911. You don't call 911 first and then give epinephrine. You give epinephrine first, epi fast, and then you call 911. Now, if you have, if there are other people around in your facility, obviously while you are giving the epinephrine and taking care of the child, you can yell for someone else to call 911. But first, always, epi first and epi fast, okay? They might also have an antihistamine like a Benadryl or something else on their orders. The doctor would write specifically here what the medication is and what the dose. But here I want to highlight for you epi first and epi fast, okay? And then call 911. The reason is an anaphylactic reaction or a severe allergic reaction can happen pretty quickly. Now, epinephrine specifically is an amazing medication. It's an amazing drug that works really quickly. However, if you wait too long to give the epinephrine might not have time to work before their airway closes. Now, hear me. I am not telling you this to scare you. I am telling you this just so you are aware. Epinephrine in a child who has a known allergy, let's use Suzy Q again. Suzy Q has a food allergy. Suzy Q has this emergency care plan in your facility. Suzy Q is starting to feel bad. How bad? Well, if you're not sure, epinephrine is always, always, always a correct answer, okay? The child is more at risk by waiting than by giving epinephrine to a child who doesn't need it. I always like to explain epinephrine to a child or someone who doesn't need it would feel like, let's say, 8 cups of coffee. They get kind of jittery, their heart's beating kind of fast. They might get kind of sweaty. They might feel kind of, icky. But it also wears off really quickly, okay? The other thing I want to highlight here is Epi first and Epi fast, and then that's an automatic 911 call. Automatic. That is not even a question. Those two things go together in tandem all the time, okay? Epi first and Epi fast, then call 911, and they always go together. You always want EMS to come, tell them you gave epinephrine, because then that will help determine who they sent to you. But epinephrine also wears off fast. So you don't want to wait. You want to give the epinephrine and call 911, and you want them driving towards you, okay? There are certainly other mild symptoms that can happen with an allergic reaction. They might just have a little bit of a tummy ache. I've seen like a lower lip that's a little bit swollen just by itself with no other symptoms. Maybe they get a little bit of a runny nose, or they have like a little spot of hives on wherever. So again, look at your child's orders down here. Your physician will be pretty specific usually. So if they have an order for an antihistamine, which would be like a Benadryl, you can go ahead and give that if we are in the mild category. If we are over here, Epi first and Epi fast, okay? Epi first and Epi fast. I don't think I can say that enough. Epi first and Epi fast. Any questions? Epi first and Epi fast. And then call 911. They go together. They're a pair. They're tandem, okay? But here you're going to have your specific orders from the physician, the dose of the medication, and all of that. And then at the bottom, the doctor will sign it. There's typically a place for parents to sign it. And then sometimes there's also places for parents to put their phone number on there. So as you kind of work down this list, you call, you give Epi first and Epi fast, then you call 911, and then working down your list, you might have someone call mom and dad, after the child has been taken care of. But your priority is certainly, certainly always taking care of that child, okay? So also know as a child, if a child is younger especially, they might not explain it like you think. I've heard kids say it feels like they have ants on their tongue, or, their tongue feels big or whatever. They don't necessarily use all these specific words. So just be mindful that they can sense it or feel it sometimes before you can see anything, and they might describe it differently than you expect, okay? So this is typically what your epinephrine auto-injector looks like. So this top one here, this is actually a picture of a trainer, but I liked this picture because it shows all the different kinds. It's a trainer because it doesn't have the glass. Oh, here, let me get my little pointer again. So this is an EpiPen, and I can tell it's a trainer because it doesn't have like a little glass window in it, and it's gray plastic. Whenever parents get a 2-pack of EpiPens, there will always be a trainer with it. So if you can see on the side here, you don't have to be able to read it, but what that is there's directions on the side of any kind of epinephrine auto-injector you have. Again, that's because if you are super stressed, your brain kind of doesn't function like normal. So you can always look at the side of your device, and it will tell you exactly what to do. For example, with an EpiPen, this blue cap right here has to come off before you give it. The orange end I like to think of as like your hot end, your hot zone. This is the fire part that you don't want to touch, okay? But if I try to give this, and you give it on the side of the leg, and you'll see it on your picture, but if I was going to give it to myself and I was standing up, I would hold it in my hand and I would go straight down. So halfway between my hip and my knee, not on the front of my leg, but on the side of my leg is where I'm going to give it to myself. And I'm going to push and hold, and I'm going to feel a click. Okay. If I don't feel a click and this orange cap doesn't come off after I hold it for a few seconds, because you want to give the auto injector a few seconds to actually inject the medication into the muscle. Look at your directions. A lot of times when you're stressed out, you might forget to take this little blue cap off. It's a safety. Okay. So look at your directions. Again, I'm going to hold it in my hand, in my fist. I don't want my fingers anywhere near this end, because this is where the needle is going to come out, and then this is where the medication is going to come out. But you push it against the side of the thigh, between the hip and the knee. You push until you feel a click, and you hold it and count to 3 to 5. It depends on the brand of the auto injector. So look at your label, but typically if you count 1, 1,000, 2, 1,000, 3, 1,000, and then release, if it's an EpiPen, this orange end will come out about another inch and actually cover the needle, so you don't have an exposed, dirty needle. These are pretty nice. They're also really expensive. So this one here, within the last couple of years, is now a generic. EpiPen is kind of synonymous with epinephrine auto-injector, just like Band-Aid is synonymous with any brand of bandage that you would put on a cut, or Kleenex is synonymous with any kind of facial tissue. So when people say EpiPen, typically, because they did such a good job in the branding department, and it's quite the amazing device to give the medication, but because there are other brands coming out now, epinephrine auto-injector is the official name. But again, people use the word EpiPen just as kind of an umbrella term for any of these brands. This one is the generic. This one will come in a plastic tube. This one, you actually have to remove caps on both sides. It'll come in a plastic tube that's 2 parts, so you have to take it out. And then you also have to take off the plastic ends. Now, you don't have to remember all this. All you have to remember is if you look at your label, it'll tell you exactly what to do. Twinject is an older brand. It's more like, I actually haven't seen one of these in several years, quite a few years actually. But that's another brand. And then this one is called an Auvi-Q. The Auvi-Q, if you think of audible, like you can hear it, and visual, so you can see it. So this one will actually talk to you once you take the cap off. It'll tell you exactly what to do. It'll tell you where to put it. It'll tell you to, push, and this one will have a black end. It'll tell you to push the black end against the side of the leg and hold for 3, 2, 1, medication delivered. So this one is super nice, and I am seeing more and more of these. Insurance companies are starting to cover the Auvi-Q a little bit more. The only issue with these is the voice is nice, but if there truly is an emergency going on and there's a lot of noise around you, you might not be able to hear it. So just know that this works whether you can hear the voice or not, just like the rest of these. And the other thing with this is if you know what you're doing, you don't have to wait for the voice to tell you, okay, remove safety cap, push it against the leg, and then click. You can just go ahead, take the cap off, push it against the leg, and administer the medication. You don't have to hear for the perfect right moment. This device will give the medication whether you are going along with the voice or not, okay? So different doses of each one are different colors. The Auvi-Q comes in red, blue, and white. You might have a kiddo who has a yellow EpiPen or a green EpiPen. The generics come in different colors, and they are not standard across the brands, okay? But just know that the different colors are different doses. So when Susie Q comes to you with Susie Q's EpiPen, that will be the right dose for her. You will have the doctor's orders and all of that. Some facilities, our facility has standing orders for epinephrine. So I am able to administer epinephrine to anyone in our facility who is having an allergic reaction, whether it's, even if it's an unknown allergy or it's a first-time allergy, but most facilities don't have that. So again, I'm going to direct you to your administration team. your facilities, procedures. You may or may not have that in place. Just know that sometimes that is possible. If you do give epinephrine, remember, epi first and epi fast, it's an automatic 911 call, and it's an automatic ER visit in my mind, okay? Those, in my mind, always go together. Now, the ER visit, the parent, of course, if they arrive when EMS is there, they can determine if they want to decline the ride or not. But I always highly, highly encourage the ambulance ride to the emergency room, and here's why. They might, when I have given epinephrine, the student wasn't doing well. They were throwing up, they were wheezing, their lungs were tightening. By the time EMS had gotten there, I had already given it. He looked perfect. The lungs were clear. Everything looked great. The dad was there saying, my kid looks fine. I still highly encouraged him to ride in the ambulance to the emergency room because epinephrine works fast and it also wears off fast. If a parent is driving their child to the emergency room, and this is their choice, so just know that, but I highly encourage them to take the ambulance ride, because if they're driving their child to the emergency room and the epinephrine starts to wear off, they could be in the middle of the road, and now what do you do? So I always encourage them to take the ambulance ride, as a side note. Okay, so as a review of everything we have discussed, we talked about medication, the authorization. You need the signature from mom or a parent or guardian, as well as a physician, how to administer it. And I gave you the acronym Dr. Time, so you can remember all of the things you need to check each and every single time that you give a medicine. If I asked you right now, do you remember what the D stands for? And it stands for two different things. It's dose and documentation. Do you remember what the R stands for? It's the route. So are you giving it orally, by mouth? Is it a topical thing, medication, or is it given another way? The T stands for time. The I stands for individual. The M stands for medication. And then the E stands for two things. It stands for expiration date and effect. Verify, we talked about storing medications, making sure that you're keeping them away from children, keeping them safe, and keeping them separate from food. Medical assistance, those were the devices we talked about, whether it's the helmet or the leg brace or something like that. We spent a little bit extra time on the food allergy emergency plan and the epinephrine auto-injectors. Check your facility. I have trainers that we can use with my staff. If you are one of my staff, please come see me. I am happy to give you a trainer if you ever get a child in your room and you would like to go over again, even though we do this training annually. I can always bring you a trainer and we can go over it for you to, get more comfortable with the actual device itself. But if you don't have that access, or you are ever in an instance where you do need to give it, always remember every single brand always has the directions on the side of the auto-injector of how to give the medication, okay? And then we talked about the different brands of auto-injectors. The medication on inside of all of them is identical. The only thing that's different across all those different kinds of auto-injectors is just the delivery system. So the medication is the same. The dose might be different, based on the size of the child or the adult, but the medication is exactly the same. The only thing I did forget to mention to you, or didn't spend a whole lot of time on, is just remember that an adult in your facility could have an allergic reaction as well, or you might. So look for those symptoms we talked about on that plan. If you're not sure, calling 911 is never the wrong answer. Get some help. Depending on where you live in relation to where your EMS team is located, it might be 5, 10, 15 minutes or longer before they can get to you. And in an emergency, that is truly a really long time. So calling 911, again, if you need assistance, is never the wrong answer. It has been my absolute pleasure to spend this time with you. I am so thankful that you chose to do this training with me today. Please always remember that, I do this to educate you guys, to help you out, to help you with getting some of your professional development hours. And ideally, I want you to be comfortable and confident in yourself and your ability. If you do have any questions about anything I have said or how your facility might be different, or depending on when you are viewing this, if any of the standards have changed, please don't hesitate to reach out to your administration team, your policies and procedures, or your licensing person. They are always super helpful. I hope you all have a great day and be well. Thanks.